very excited today to have Dr. Barry S. Levy. He's a physician. Since 1993, he has directed the Environmental and Occupational Health course for MD and MPH students at Tufts University. His expertise includes occupational and environmental health, the public health impacts of war and terrorism, climate change, and social injustice. His dedication to public health is reflected in his research, contributions, articles, and books. As a former president of the American Public Health Association, recipient of the Sedgwick Memorial Medal, and an international health advocate, he continues to contribute to the future of public health. Welcome, Dr. Levy.
A pleasure to be with you, Pajetra.
So, share with us about your tenure as president of APHA. What are some of the reflections you have from that time?
Sure. So I served as president in 1997. A lot of my work was supporting state and local activities, public health activities. And I actually visited public health programs in all 50 states over the 3 years of my president-elect, president, and immediate past president years. A big theme of my presidency was putting the public in public health and engaging people in the decisions that affect their lives and improving public awareness of what public health really is. You know, it was interesting that so many people in the general public support immunization, they support family planning activities, they support control of infectious diseases and chronic disease, but they don't understand what the field of public health is all about. They sometimes confuse it with delivery of healthcare for low-income populations, and of course public health is much broader than that. So a lot of my focus in my presidential year was getting out to communities all across the country and letting people know what public health was and raise the awareness of public health. I often said that public health is what happens on a day-to-day basis. You get up in the morning and you brush your teeth, and you may be using a fluoride-based toothpaste or using fluoridated water, and that's public health. You go down and eat breakfast, and there's nutritional facts on your cereal, and you're eating more nutritious food for breakfast, and that is public health. You get in a car, or better yet, ride your bicycle to get to work or to school, wherever you're going, and safer vehicles and reducing greenhouse gases and improving so-called active transportation, walking and bicycling, all that is public health. A safer workplace, and on and on. So I would often explain public health in terms of what people do on a day-to-day basis rather than talking in terms of the administrative framework of the HH&S and so forth. So the other thing I did was very exciting. I got, as a president of APHA, you get to present your presidential citation to anybody in the world you'd like. And so early on in the year, I decided I wanted to present it to President Nelson Mandela of South Africa. And through a lot of efforts with people who knew him and worked with him for many years, including former editor of the American Journal of Public Health, I was able to, and along with Mohammed Akhtar, then executive director of APHA, to fly to South Africa and to present the APHA presidential citation to Nelson Mandela. I get goosebumps just recalling that opportunity. And we actually got to spend about 20 minutes with him talking about public health and to present the award, which was shown on a videotape at the annual session and is available on YouTube. Anybody can watch it. So,
well, Nelson Mandela is such a wonderful individual and such a legacy to the whole world.
Yeah, an inspiring person. And it's actually somebody who did so much for public health and human rights. So yeah, it was a great thrill.
Wow, I'm just curious. Why did you choose Nelson Mandela?
Well, you're given anybody in the world, and I was looking to see, sometimes you think about things that almost look like they're impossible, and then if you make a commitment to do them in some way, and then able to fulfill that commitment, it's very empowering. So he was somebody, of course, many of us looked up to, who was an inspiration in so many ways, and I felt very fortunate to create the opportunity to present the award to him.
I'm sure.
Yeah.
That's wonderful. Now, tell us about your work you're doing at Tufts University.
Yeah.
Could you share a little bit more about
that? So I'm an adjunct professor at Tufts Medical School. I've been there for 30 years in that role. Part of what I do is I teach a required course for the students who are getting both a medical degree and a Master of Public Health degree at the same time. And it's now in the 31st year of teaching the course, and each year it's evolved. I bring in a lot of guest speakers. I learned a lot in the process, and as I tell my students all the time, a lot of what we're providing them an opportunity to learn about is skills rather than hard facts, because the facts, which science and public health is a dynamic field. The facts change and evolve over time, but the skills and even more importantly, the values that underlie public health, respect for human dignity, focus on prevention, treating all people equally, and really not only thinking these things, but acting in public health to follow those values and those principles. So a lot of what I teach in the course is related to important environmental issues like climate change, like lead poisoning, like workplace safety. But a lot of what we also teach is about the values of public health and how important they are.
Great. So you mentioned climate change and you mentioned the impact of war on public health. Can you elaborate a bit more on that?
Sure. So about 10 years ago, I teamed up with a colleague named Jonathan Patz, who's worked in climate change and its effect on health for much longer than I have, for 20 plus years. And we teamed up to develop and edit a book with many contributors, over 50 contributors, on climate change and public health. And we focused on a lot of the public health problems that are related to climate change: heat-related disorders, respiratory disorders because of more air pollution, vector-borne diseases like malaria, waterborne diseases because of more floods and droughts, which lead to less and less of safe water available. We talked about in the book malnutrition as a result of the impact of climate change on food, mental and behavioral disorders. And we also talked about violence and how climate change can contribute to violence sometimes. So the book was very successful. It was actually voted as the Environmental Health Book of the Year by the American Journal of Nursing that gives out those awards. And we've just completed the second edition of the book, which Oxford University Press is going to be publishing in February.
So we're very excited.
I keep myself busy. So, but the other area of my interest, in addition to climate change, is the impact of armed conflict, but in fact, basically of war on public health, and the profound impacts that war has on public health, but also what we as public health practitioners can do through education, through documentation and research, through public health practice, and development of policies, public health policies that can help reduce the consequences of war, the public health consequences of war, and also ultimately work toward preventing war itself.
Now that's a very interesting concept. You say preventing war. So
preventing war, yes,
has the power of preventing.
Yeah, I mean, you can argue that if you look at total morbidity and mortality through the world, so much of it is due directly to war and the indirect effects of war, because war often damages the infrastructure of public health, for example. Less immunization programs, less investigation of outbreaks, damages the food and water supply systems. So there's a lot of both direct and indirect impacts of war. And despite all these major impacts of war and the amount of money that goes towards military expenditures, we have very little about war in our public health curricula. Very few courses, even in schools of public health or public health programs, deal with war, even the effects of war that are in our own communities, the PTSD and depression that affects returning veterans and their families, the refugees, so many refugees in our country and many other countries who have left their homelands and their communities, often their whole families, coming to this country, but often displaced from their homelands because of war. So we don't have to look very far. We can look just in our own communities about the impacts of war on people living in our own communities that need our attention in public health.
Yeah. And you make me think about the program to eradicate polio. They haven't been successful in eradicating polio, and one of the reasons is war zones.
Yes, exactly. In fact, the countries in which polio still exists have been war-torn countries. And it's a very good example of how, unless we solve the problem of war, we can't solve other problems like polio. So health and peace, in effect, go hand in hand.
Definitely. Now, you're a teacher. a professor, and you deal with generations of students that come and go. So this new generation of students, is there anything in particular that you see in this new generation of
Yeah.
health workers?
Yeah. So I see two things in the students that I teach. And actually, I see it less as teaching them as giving them opportunities to learn, because I think the things that we really remember are the things that we, engage in our own learning process. But two things that I see is that students seem to be in recent years and currently much more engaged in social issues. And we see it here at this meeting of students who are really engaged in climate change and armed conflict and refugee situations, and wanting to figure out not only what they can do now, but what kinds of careers do they want to create for themselves in which they can actively address these issues. The other thing I see in the students in my course that I teach is so many of them have had experiences either working with low-income populations in this country or working in other countries in a whole variety of situations. And that certainly wasn't the case when I went to medical school. The vast majority of my classmates, really didn't engage very much in those issues.
And how do you see the impact of technology, AI, social media? How's that impacted?
Yeah. Well, the short answer is I don't know, and I want to learn. But I'll tell you what. Together with a close colleague of mine, Dr. Carol Easley Allen, we put together a session that we moderated yesterday on the impact of artificial intelligence on public health. We had a packed room. We had over 300 people, along the side of the room, standing in the doorway, and so forth. It's an area of public health. It's an area that we in public health need to learn about. We need to engage in it before people outside of public health start making decisions that are going to adversely affect not only the field of public health, but the public's health. And so I think it's very important for us, as we keep up with so many other things, to keep up with AI and to learn not only about the potential pitfalls of AI, but how we can embrace AI and how we can use it to improve disease prevention, improve analysis of data, identify high-risk groups, better evaluate interventions, and so forth. So I think there's a lot of things we can do to learn about and ultimately master AI. So
yeah, that's a good point. Don't fight it. I think it has a lot of benefits, and every industry is.
That's right.
It's bombarded by AI. Business, arts.
Yes.
In healthcare will definitely be.
Yeah, absolutely.
No, we are at APHA 2023. So far, how has been your experience at APHA?
Well, I'm very. I personally my batteries become recharged every time I come to this. This is, I think, is my 50th APHA meeting. The first one I went to was 1973 in San Francisco, and I think I only missed one since that time. So it's something I look forward to every year. It's an opportunity to reconnect with friends, but not only to share information, but to, you might say, empower one another, to get energy from one another. What's especially gratifying to me is to see so many younger people not only come to the meeting, but to come here and become engaged, to share their enthusiasm, to share their interests, and to look at ways in which they can become engaged and build a better APHA for the future. So I feel very enthusiastic in coming here and appreciate the opportunity to speak with you.
Yeah, we can see the enthusiasm coming all over your face. So it's so interesting you say San Francisco 1973, because
yes.
We are here at the Latino Caucus booth.
Yes.
It was San Francisco's 1973 when the Latino Caucus was formed.
Yes.
So we are celebrating our 50th anniversary.
Yes. And by the way, for many years I attended the Latino Caucus dinner. One of my colleagues at that time was Marilyn Aguirre Molina.
Oh, yeah.
And actually, she and I ran for APHA executive board at the same time and were successful in being. So we served on the APHA board together. I think it was from 1989 to 1993.
Well,
so,
today's a chance to see Marilyn. She's going to be the keynote speaker for gala tonight to celebrate our 50th anniversary.
Wow, wow, very exciting. Well, I salute the work you're doing with the Latino Caucus. Really very exciting.
Thank you. Thank you so much, Dr. Levy, for sharing with us.
Great to be with you.
It's been a pleasure speaking to you.
Pleasure speaking with you. Thank you. Thank you, Pietro.